So I have to drink that syrup or whatever.
Yeah.
Oh my God.
Yes, you do. Any headaches, nausea, vomiting, bleeding, or discharge?
No.
Okay. Super. I have to share with you, my daughter is expecting, and she's, when are you due?
February
February
10th, like around 10th.
Okay, that,
Because it was February 10th,
Yeah.
but it was before we did the ultrasound, so
yeah,
I don't know after ultrasound, like the measures and
yeah.
what's the
So
date.
she's due within days of you.
Mhm.
And it's funny when you said it's as big as an eggplant because she tells me every day.
Yeah.
She's also following that same application.
She is, yeah. It's as big as a papaya.
I
It's
don't know
as
which
big.
one.
This one. It's as big as an eggplant. And she's much larger than you, but she's a bigger girl. So I'm just rolling in there, the baby, a little boy.
Yes, but it's like before it used to be more movements, now it's less, and it's like I hear like some
Oh,
little
yeah.
beating, like a little, I don't know what's that.
Okay.
So I'm gonna see how the doctor.
Yeah. Oh, I've been trying to baby this cord here, as you can see, for a while now, and it's just getting to the point where it's not.
He wants to part
Yeah.
ways.
It does. It does. So let's see. Well, no, 8/7. That's what. Alrighty. I'll send him in, okay?
Не хочу ждать после того. Сколько он сказал, что надо ждать после того, как пьешь этот.
Полчаса. Или больше?
Мне кажется, полчаса он говорил, и поэтому я сказала и это, и нас сказала и это. Ну, говорят, говорят. О, носик чище, да, ставьте.
Тебе на память.
Куда приходит колд? Извините.
Сегодня какой тест делают?
Нет, зачем это тест и поставить мне укор? Посмотреть. Сейчас такие битсы.
Morning.
Morning.
How are you three?
Yeah.
Doing well.
Good. You made it here in the cold?
Oh yeah. Was ice fishing yesterday, so.
Yeah. It's a little nasty
Crazy.
out. Yes, I agree.
That's crazy.
Very cold, I don't like it.
Mhm.
But, nobody cares. It's just cold, we have to deal with it.
Yes, this is Wisconsin. This is where we choose to be.
That's right. How you feeling physically?
I'm feeling good.
Yeah.
Still have pain, like sometimes when I stay too much in my feet, I still have
Yeah.
pain, and but it's like I don't know, like before last week I was feeling more like movement. Now it's a little bit less, but I hear like beats, like
Okay.
lower,
Yeah.
the lower or here right now I was feeling like tuk. I don't know what's that.
Well, I'm sure it's likely the baby still. Part of the issue is most women, as they get into the about 30 weeks or more along, they start to feel baby a little less because the baby's starting to get scrunched in there a little bit more. But we'll listen today and see what the baby sounds like. You're not having any bleeding?
No.
Okay.
Everything is
And no symptoms of concern with going to the bathroom, urinating at all?
No.
Okay. So it doesn't sound necessarily concerning, what you're describing. If the baby wasn't moving at all, I'd be more worried than maybe just moving less.
It's
So-
moving, but it's like I hear this beat, so
Sure.
I don't know.
But it says like hiccups or gargling, something.
Could
Something like-
possibly be, yeah.
Yeah.
It'd be hard to know unless all of a sudden you were doing a picture right when this was happening and
Yeah.
saw it, but
We're talking about, because she said that right now it's, the baby is kind of starting to engulf some of the fluid. So how does the connection go in and out through the cord? I know that it gets fed and
Yeah.
breathes through the cord, but how does it release stuff? Is it just releasing in the?
how does it release like urine in that? So
it's floating in there.
Yeah,
right?
so basically all amniotic fluid is primarily urine. And the baby usually does not have a bowel movement until either after delivery or just before delivery.
Yeah,
And that can be an issue if they have one before they're born.
yeah. That's usually the black stuff. The
Yeah,
first,
and we don't have any way to necessarily keep it from having that happen while it's in utero.
Mhm.
But yeah, the baby gets fed through the umbilical cord. It technically doesn't take mouth or nose breaths like it would once it comes out. It's pretty amazing how the body actually, essentially in the delivery process, expels most of that fluid. Not all of it, because still there's some that the baby will bring up after delivery. But that happens all in the process of the delivery process, labor and delivery process. So it's hard to really explain more than that to the situation, because I don't think a lot of people understand, even doctors understand fully why it happens the way it happens, but we know that the compressive forces of labor tend to start to expel some of that fluid out of the body, and it's not until the cord's actually clamped and cut that the baby's no longer getting stuff from mom. So
Because it basically stuff goes in, but stuff doesn't really go out. It stays in that amniotic fluid, or
there's actually stuff that does go back.
oh,
that-
okay.
So there's
There is a return, yeah.
yes, there's vessels that take blood to baby and a vessel that takes blood away from baby
Okay.
through the cord. So there is breakdown products and all that
It
do
also-
get still,
okay.
and then mom excretes that technically.
Yeah, because kidneys and liver
Yeah.
already work on the baby. Yeah.
Exactly. All right, so you are 28
Yes.
weeks along, so you have to get a shot today.
Mm-hmm.
Well, maybe two. Have you gotten the flu shot yet?
I got the flu
You
shot.
did get
Yeah.
the flu shot, so we're good there. But we got to give you the Rogam shot because of your blood type being Rh negative. Did you drink the
No,
orange stuff yet?
I told them, and I told the nurse too, and nobody brought me.
All right.
Nobody
well,
sent me anywhere.
The juice.
Yeah.
Yeah. Okay. Well, I wonder what that's about, but we'll get you the juice. Yeah.
Okay. So now we need to listen to the baby.
Yep. measurement first of the abdomen. The hands are probably freezing, sorry.
Fine.
So you measure okay. So you're getting pretty excited? Getting closer.
Mm-hmm. I don't know. Scary about the delivery or no? I thought it was gonna be the smooth.
Baby's moving just enough. Really. $125. Sounds good. 121 to 133. It's falling in that range, so that's normal. Low normal now, but it's normal. Alright, so let me move this back over here. So what we'll want to do is make sure that you get to drink the orange stuff. Then you get a blood draw an hour after, and you also got to get the shot for the RH or the blood type, and then you're at a point where we see you now every couple weeks, about every 2 weeks roughly. If it's a little longer, depending on your schedule, that's fine. You know, you're doing well. Pregnancy's overall going smoothly. It doesn't have to be exactly every 2 weeks. Whatever works best for you with your schedules are fine. No questions are silly questions, so things come up, you know, don't hesitate to ask, because just like what you're feeling, which is hard for me to know for certain, yeah, is that hiccups, is that positionally the way the baby's suddenly sitting, that you're feeling things a little different. It could be a little both, but the baby sounds good. Some movement's still a good sign. If ever you felt like a baby's definitely dramatically less movement, or you're having bleeding, you've got to let me know, because that could be a concern. Now, there's a lot of times when that does happen to women where it ends up being nothing concerning, which is good. But if you were having any symptoms like that all of a sudden, then you got to tell me, because a reassuring thing is baby moving. Even if you felt a little different or felt a little weird or weren't feeling good, a baby that's active is a good sign that things are probably fine, and it just might be your body's not feeling the best. Heartburn can start to become more and more common as you get later in pregnancy, where your stomach might bug you some. If it becomes enough of a problem, you can use medicine like Prilosec or Pepcid or even Tums to help that. It may not be a problem though. Sounds like your back and your leg are going to continue to be the maybe biggest annoyance, and you know, if that keeps being an issue, you can for that even see someone to get some help for that. But part of that just depends on how it keeps going. All right, so I'm gonna go let them know to get the juice.
So we need to wait an hour after.
Yeah, for that blood draw, and then assuming that's normal, like I think it will be, then you shouldn't need to deal with any more of that, because that's just screening for sugar diabetes in pregnancy, which is important to screen for. I think your risk is low that you'll have that, so I'm not too worried about it. So, okay. All right, I'm gonna go let her know.
Thank you.
Yep.
Thank you.
Stay warm out there.
Yeah, so we
As best you can.
We'll do our best. Thank you.
In the book.
Okay.
I'm going to give you this. This is to carry in your purse if you were ever in a accident and someone needed to know your blood type. So this is for you to keep in your purse, okay? You're welcome. Okay, so, yep, just need right there. All right. Do you want to sit on, or stand on?
I don't know.
Why don't you stand down?
Okay.
Perfect. And I
Not gonna be too
apologize.
much pressure on this leg.
You're okay, whatever you feel comfortable doing.
I don't want the muscle to be tight, so it's gonna be painful. I hadn't had one in my hip.
Never had one in the butt?
Since I was a kid, I think.
Alright.
I'm afraid. It's gonna hurt?
It's gonna hurt a little bit.
Oh my god.
Okay. Alright, I'm gonna count to 3 and I'll poke on 3, okay? 1, 2, 3, poke. Sorry. Just putting the medicine in. All done.
The smiley face on her butt now.
Okay. Oh, you're all done.
Oh my god.
So
Yeah.
technically what this does, it protects the baby from being rejected.
That's correct.
Okay.
Yep, that's correct. And then when you are postpartum,
Mhm.
you get one more.
Yes. For the next
Yeah.
When-
The joys. It's all gonna be so worth it though.
Oh yes.
Yeah. Okay. Well, you guys are all set. We'll give you a call on that test for the sugar that you took.
Yes.
We'll give you a call hopefully today, and we'll be in touch. Okay.
Thank you so
All
much.
right. You're welcome.